Hi, I'm Dr. Becky Lynn. I'm an obstetrician gynecologist at St. Louis University, and I specialize in sexual problems in women. Today I'm going to talk about common causes for low libido. Low libido is one of the most common complaints that I hear from women, and it can happen in all age groups from 20s to 70s. And there are so many reasons that women can have low libido, from physiologic to psychologic. And usually in my visits, I will go through all the different aspects and the history in order to get to the bottom of the low libido. And most times, I usually find several issues that contribute. Some of the psychological things that can affect low libido are chronic diseases, things like diabetes or heart disease or neurologic disease. Other things are medications. There are many medications that can affect your sex drive. The worst offender of those medications are the antidepressants in a group called SSRIs. SSRI stands for Selective Serotonin Reuptake Inhibitor, and these are things like Prozac, Zoloft, Paxil. Those antidepressants are very commonly used in women, and depression happens very often. But many women are unaware that their antidepressants are actually contributing to their low libido. Some of those same antidepressants also cause orgasm problems, difficulty reaching it, or inability to reach orgasm. Other things that contribute to low libido in the physiologic realm are things like menopause. Menopause contributes to low libido in that your hormone levels are lower. You may have vaginal dryness that causes pain. And pain is definitely a mood killer when it comes to libido. If sex hurts, why do it? Other things that can contribute to low libido are psychological issues like depression and anxiety. Prior sexual or physical abuse definitely plays a role, and sometimes that accompanies depression and anxiety. Substance abuse, alcohol use, narcotic use. Stress definitely plays a role. When a woman is stressed, the first thing that goes is her libido. It takes a lot bigger stressor to affect a man's libido. For women, it's one of the first things that goes when a woman is under stress. Other things that play a role are drinking, use of drugs. We forget about those things, but substance abuse and alcohol abuse can definitely affect a woman's libido. Sociocultural influences also play a role in low libido. We are a product of how we grew up. So how we look at sex and how we approach sex depends on what our parents taught us about sex, and we forget that. We don't realize that. I always ask my patients, what did your parents teach you about sex? Was it positive? Was it negative? Or was it nothing? And I think that a lot of women feel like it's a cultural taboo. Women shouldn't enjoy sex. That's what they were taught. It's just for procreation, don't do it. Women get a negative message about sex when really we can all enjoy it, and we should enjoy it. And lastly, relationship issues are so important to libido. Even in the best of relationships, there can be communication problems between partners. I always get to the bottom of the relationship. Some people don't feel comfortable discussing their wants, their needs, or what feels good to them with their partners, who are very well-meaning. Their partner likely wants to please them, but it's just a communication issue. It could also be due to lack of a partner or lack of privacy. If your child is in the room next door and you don't have a lock on your bedroom door, well, your libido is going to be ultra low. So those are some of the things that can affect libido. The list is so much bigger than what I have time to discuss here. But next week, I'm going to talk about some of the treatments for libido, because there are plenty of things that you can do to improve your sex drive. So thank you for listening. Please subscribe to my channel, and I'm going to discuss different sexual issues each week. Bye-bye.